Hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am streaming live from Sioux Falls, South Dakota in Central Time. That's why we're starting a little bit early today, earlier than planned. Excuse me. And I am super excited to have Jennifer Woodward back on our podcast, our midweek podcast of Health Solutions. And she's going to be discussing PMS and Amenorrhea. And actually what the definitions of those are. So if you don't know or don't believe it's real, stay tuned. She is actually from Functional Diagnostic Nutrition, which specializes in training people to be practitioners in functional medicine through nutrition. And as you know, if you follow us at all, Jen and I are two pharmacists that don't believe in drugs to treat most chronic diseases. And nutrition, exercise, and sleep plays a big role in all of that. So, Jennifer, welcome back to our show.
It is so good to be here. I feel like now this is just part of my week. I'll be bummed if we don't get to hang out next week.
I know, I love it. Well, you were such a good guest the first time. I'm like, okay, we got to have her back on. So we're having you on a couple more times. So I really appreciate it. Love your wisdom and knowledge. So tell us a little bit. Thank you. Tell us a little bit. First of all, let's just start with PMS. Tell us about what PMS means and what your experience is with it.
Well, I could write a book on PMS, both personally and professionally. So PMS refers to premenstrual syndrome. And that, of course, is any cluster of symptoms that a woman experiences before her period. So that tends to happen, the week before, about 7 days before she actually starts her bleed. And that's the end part of the luteal phase of the cycle. The luteal phase lasts, anywhere between 14 and 20 days or so after ovulation. So PMS generally is going to be, defined as a cluster of symptoms, including moodiness, irritability, insomnia, bloating, cramping, a lot of anger, like anxiety and depression can kind of, manifest during that later luteal phase. And a woman knows if she's experiencing PMS. There are memes that just abound on the internet. There's Facebook pages, you can type in PMS to Instagram and find a lot of true information and then false information on PMS. But it is an issue for so many women, of menstruating age, because it's become somewhat of a scourge or a plague, on Western women. They almost use it, as a meme or a joke. It can be so frustrating and confusing.
Yeah. And I kind of make a joke. It's like if some doctors don't believe it's real. And I make a joke that if a doctor doesn't believe it's real, he's never been married or had a very close girlfriend. That's because it can definitely be real.
It is definitely real. Yeah. Or we'd say a daughter, right?
Yeah, right. You're right. Same thing, right.
Never had a teenage daughter. Yeah, for sure. So, is it a clinical definition? Maybe not necessarily. I do believe, though, in the recent issues of the DSM that it actually is an issue, right? Like actually,
official diagnosis.
Right. So thank you. Yeah. And less classified, as a physical disorder, is more of a mental or emotional disorder, according to psychologists and psychiatrists, which is very interesting because, of course, it runs the gamut between physical, emotional, and mental.
Well, and speaking of that, a lot of times what the traditional Western medicine treatment is antidepressants. Which I have a big problem with. I mean, another thing that I have a problem with, which we talked about when we talked about infertility and PCOS, is, if it's hormonal, we're just going to put you on birth control pills, right?
That is the twofold, yes, general prescription would be birth control pills plus an antidepressant for PMS. Yep. Right.
So tell us how you were trained through Functional Diagnostic Nutrition to treat PMS.
So at FDN, we say we don't treat anything specifically. We're not doctors, so we don't diagnose, treat, or prescribe, but we look at the body, as a non-specific entity, right? So our kind of founding, starting point is that the body, when it is experiencing symptoms, is in what Ray Davis calls metabolic chaos. And essentially, it is a dysregulation of the HPA axis. So the body can't input these stress signals from the outside environment or the internal environment. And so the brain starts giving the wrong signals to the endocrine system. It tells the rest of the body, to fire inappropriately. And we know that hormones are not to blame themselves. They're simply reacting to a state of the body. Hormones are just chemical messengers. They don't actually, they're not out to get you. They're just responding. So with this state of, hormonal chaos, HPA axis dysfunction, our bodies are misrepresenting some of the signals that are coming from the outside. So at FDN, we're looking to uncover these hidden stressors that the body might be experiencing. So we'll go into the hormone system, the immune system, we'll go into the detoxification system, the digestive system, the endocrine system, and we'll do that through a series of functional tests that help discover anomalies in all of these systems. And as we start peeling back, the layers of the proverbial health onion and see, does a woman have, small intestinal bacterial overgrowth or a parasite, right? Is she experiencing really elevated levels or really low levels of cortisol or adrenaline? Is she really in estrogen dominance? So we can see on something like the Dutch test where estrogen levels are sky high and progesterone levels are not even on the chart. And so using those lab tests, we're not necessarily diagnosing or treating, but we're teaching our clients to address the anomalies in these systems. And they start feeling better so quickly, right? Because the brain is now getting the correct signals and therefore can tell the hormones, what to do appropriately, especially with that HPO axis for women. So the hypothalamus, the pituitary, and then the ovaries, right? If the hypothalamus and pituitary are firing correctly, interpreting stress signals correctly, then the ovaries do their job. And less PMS.
I love it. I learn something every time you're on our podcast. I've never heard HPO axis, and I'm like, okay, but HPA, hypothalamus, pituitary, adrenal, HPO, hypothalamus, pituitary, ovaries. That's awesome. Yeah, and that is a very, if you have that dysregulation, it's gonna really mess with a lot of things, and you're not gonna work optimally. So let's talk about the Dutch test. What specifically is that? I get questions quite often on the Dutch test, or I get questions on, how do I test my hormones? And, there's 3 different ways that I can think of right off the top of my head, and that's serum or blood, and then saliva, and then urine, which is a Dutch test. Go into the Dutch test.
Sure. So, we'll of course look at all of those modalities. We find that blood testing is probably the least reliable when you're looking at long-term hormonal symptoms, just because it's a one-time snapshot. We do love saliva testing as well. Dried urine test for comprehensive hormones. That's what Dutch test stands for. You can use it even if you're not Dutch. And the Dutch test, is collecting 24 hours worth of urine. So we're looking at metabolites of a lot of the hormones in the body. The reason I love urine testing is because, we're looking at a lot of steroid hormones, sex hormones. Those are bound up, a lot of them in our fat tissue. And so if you're looking at a serum test only, you're looking at levels of hormones that are in the blood at any given time. It's not giving the right picture, the correct picture of especially estrogen, estradiol, which again is bound up in our fat tissue. It has a cholesterol backbone. It is a sex hormone. So thereby, it's got a fat backbone. So it likes to sequester itself, kind of hide itself in our fat. And for a lot of women, they're nodding. They're like, well, I got plenty of that then, right? And right. It's kind of true. So we do see an incongruency when we're testing, looking for estradiol levels and testing blood or serum versus urine. I tend to see on the Dutch test much higher levels of E2 or estradiol than I do on serum, because it's a more, a deeper look, a better picture of true estrogen levels. Now, the Dutch test doesn't just test estradiol. It also tests the other 2 estrogens we have in our body. So E1 or estrone, E3, estriol. So women don't just have one kind of estrogen. There are 3 different types, and those estrogens can all interconvert right into each other. And we look at a couple different pictures specifically with estrogen on the Dutch. Estradiol is the strongest and most abundant estrogen in the body. So it's going to do the most work at the heavy lifting. Estrone is mostly made in our fat tissue, and it's a weaker and less abundant estrogen. And then estriol, is a lot of what we play around with as functional diagnostic nutrition practitioners. It's E3. And again, it's a little bit less abundant and a little bit less maybe forceful in how it works in the body. Estriol, I really like too, because it tends to be a really indicative of what's going on in our gut health. And we can talk about that later on too, that, as FDNs, we are looking at gut health for our clients as well, not just hormones. Okay, so that was a long explanation, but let me be really clear. The Dutch test looks for estrogen, testosterone, progesterone, cortisol, adrenaline, melatonin, DHEA, and then an array of organic acids, including B12, B6, biotin, glutathione, a marker for neuroinflammation, quinolinate, and dopamine and serotonin. So kind of precursors to some of those neurotransmitters. I'm probably leaving one or two out, but it's 7 a.m. So that's why. But it's a really comprehensive test that gives us a full picture of what a woman's hormones are looking like, again, over a nice 24-hour period of time. We test at day 19 or day 20. So you're fully into the luteal phase when progesterone levels are theoretically the highest. And that's one of the most important markers that we're looking at, especially for PMS when we're running the Dutch test.
That's very, very comprehensive test. And I like the idea, what you said about, a blood test. And we get this all the time with blood testing. It's a small snapshot in time. I mean, a very small. That's only what your body was doing at that specific time. So if you're testing level of hormones, it's like, well, that's what your hormone was at that time, but we don't know what it was 12 hours later, let alone 2 hours later, and it could be different.
Yeah, and one of the problems women aren't necessarily getting their test run at the correct time. Again, we really want to capture that 24-hour period where the luteal phase is swelling with progesterone levels being the highest. So, I've seen multiple occasions where women don't realize that they need to be testing progesterone specifically at, day 19 or 20 of their cycle. And so we're getting an errant reading. The Dutch test has a really nice, clear instruction. If you're working with a knowledgeable practitioner, that practitioner is going to guide you through testing correctly for the Dutch, which again, right around day 9 or 20 of the cycle.
That makes total sense. So then based on the results is based on how because a lot of times with the Dutch test, there's methylation issues, for instance. So is that something that you really go into and talk about nutrients that can help metabolize hormones better?
Ooh, that's a great question. So yes, this is definitely one of the things we test for with the Dutch. It's one of the first things my eye is drawn toward because the Dutch test does look at different metabolites of estrogen. So as your body, gets rid of that estrogen, which it absolutely needs to do, ladies, it's going to, move it through the body with a process called methylation. All right. So we see on the Dutch, it's this beautiful little pie chart. I tell my clients it looks like a little Pac-Man. So the body can metabolize estrogen down the 2-hydroxy pathway, the 4-hydroxy pathway, or the 16-hydroxy pathway. We really want that nice, clean 2-hydroxy pathway. And on the Dutch test, there's a little Pac-Man dial or a pie chart that shows that 2-hydroxy pathway as a green, part of the pie. So we want to see a lot of green on that pie chart. If we see a lot of blue or red with that 4 or 16-hydroxy pathway, we know that there's a possibility toward DNA damage. And again, we're not doctors and don't diagnose, treat, or prescribe, but the Dutch test does show that if you're popping up with more of that 4 or 16-hydroxy pathway kind of methylation, it can lead to possible estrogen dominant cancers in the future. And so it's really good for clients to run that test like around, their 30s or 40s, because we want to look, we want to see, is there DNA damage that's happening right now that we can somehow kind of course correct, which we absolutely can if we catch it early enough. Now, to your point about, what foods, what nutrients can support methylation, Chris Masterjohn has one of my favorite kind of blog posts, maybe YouTube videos on this, where he reports that 5 grams of creatine actually really increases methylation in the body. So if you are, methylating down a poor pathway, I myself would recommend, more creatine for my clients. 5 grams is this tiny little scoop, of creatine powder that you can add to your water or your smoothie. He also recommends 5 eggs a day. 5 eggs a day have enough methionine to help the body methylate correctly. And that's a really inexpensive and tasty and easy intervention. Like, I know we're going to talk meat here and animal products in just a second, Shawn, because I know you, but it's just fun. Like, man, I'll have clients who come to me, they're eating chia pudding in the morning, they're drinking coffee, like black coffee in the morning, and that's it. They're, having a plant-based breakfast. And I, kind of try to sneakily guide them over to eventually eating 5 eggs a day for breakfast. That shuts down cravings, that helps weight loss, that helps them be in a extraordinarily balanced mood with all the choline that they're getting for brain health in those eggs. And it's kind of life-changing. So, supporting methylation pathways, supporting weight loss efforts, and supporting brain health and mood during PMS is kind of like magical. So if you're methylating incorrectly or poorly, of course we can add things like B12. I'm not a huge fan of synthetic supplements. I'd rather add the food. So, a little bit of creatine powder plus those eggs can be really life-changing, if you're methylating incorrectly. We can talk supplements in a second, but I kind of wanted to hear your thoughts on that.
Yeah. I first thing I think of when I think of creatine is I think of meat. Eat red meat. I mean, red meat has a lot of creatine in it. So, and like you say, creatine's 5 grams is a small amount, actually. Now, I don't know how much on an average serving of beef 5 grams is, but it's such a small amount, which 5 grams is about a teaspoonful. I'm going to think if you eat a regular serving of beef, you get 5 grams of creatine, but I don't know that for a fact.
Yeah, if you're eating regular amounts of red meat, which I encourage every single one of my clients to do, you are likely getting enough creatine. It's definitely true. And then adding those eggs in again, if you're not sensitive to eggs, and some of my clients are, right? They're more sensitive to the egg white than they are the egg yolk. And the egg yolk is that really nutrient dense part of the egg anyway. That can take care of a lot of your issues that you're experiencing during PMS. On the supplement side, specifically for the Dutch test, because regular blood work and salivary hormone testing do not test for methylation. But if we do see that inappropriate methylation with the 4 and 16 hydroxy pathway, then I love DIM, so diindolylmethane. And I tell my clients it's basically like a supersized serving of broccoli or cruciferous vegetables that research shows helps push methylation down the correct pathway, the 2-hydroxy pathway. And Dutch itself actually has, a white paper showing that within 2 weeks of using DIM, you can course correct and begin methylating down that protective 2-hydroxy pathway. So since the Dutch is expensive, I haven't personally clinically corroborated that because I'm not running a second Dutch 2 weeks later. But when I do follow up with my clients, 6 months or so, 9 months after we've been doing the whole dress protocol that we would do for, a PMS or amenorrhea client, we do see that the client is now methylating appropriately. But it's a whole gamut of things, not just, a supplement, not just eggs, right?
Yeah, absolutely. And eggs are so nutritious in so many ways and so filling. And I got to be really honest with you. I don't know if eating 5 eggs is difficult. I mean, it's a lot of food. I
challenge you, Shawn.
Yeah. And I'm sure I could do it for sure. But typically we eat eggs and bacon or eggs and sausage. And I tell you, I invariably, even if I'm hungry and I'll tell Janet, I'm like, how many eggs you want? I want 3. If I'm hungry, I'll say I want 3. And after I eat sausage and 2 eggs, I'm done. I mean, eggs are just so filling. So, and so nutritious. I mean, you think about what they're meant to do. They're meant to be nutrition for a newborn bird. And that's all they eat is mostly the stuff inside the egg. So it's got to be full of nutrients to sustain them.
100%. Yes, 100%. And that, you think about it, when you look at 5 eggs on, like, let's just say you scramble them, it doesn't look like much. You can fit it in your cupped hand, right? But why are they so filling? Well, it's because, like you said, they are so nutrient dense, full of fat soluble vitamins, full of protein, full of good fats. And really, an egg is kind of perfect in what it provides for us with an appropriate amount of fat, an appropriate amount of protein. I usually recommend that my clients, round out that meal with some carbohydrate, in the form of fruit. But, that's specifically for PMS and digestive health. Just to touch really fast on this egg story, because I've kind of been fascinated with since I, was studying methionine and Masterjohn and, how nutrient dense eggs are, especially with regard to methylation. I have this, purportedly vegan client right now. She's actually a physician. She's a doctor. And she came to us with a lot of hormone issues and didn't like to eat meat, didn't like to eat animal products. And so we've slowly been weaning her onto like really high quality pastured local organic eggs. And she's 136 pounds. She had some vanity weight she wanted to drop. She wanted to get down to like 125 pounds. So I told her I could support her with that as long as we were eating a nutrient dense diet. And previously, she's eating quinoa and chia seeds and a bunch of like cruciferous vegetables cooked in fake butter, like vegan butter, for breakfast. And she was just complaining of these horrible stomach aches all day. She didn't realize, that all that fiber, especially all the FODMAPs based, like slow digesting fiber, was just setting her up for a day of really poor digestion and low energy. And as we've slowly tweaked, gone from 2 to 3 to 5 eggs, she's dropped 2 pounds finally that she hasn't been able, that was just last week, she dropped 2 pounds. And we haven't been able to move weight with her since she started about 6 weeks ago. And she said her mood is better, her energy is better, she has more patience with her kids, her sleep is already better. So I won't say eggs are magic, but they approach that benchmark for sure.
They do. Yeah, for sure. Okay. So on PMS, we could talk about that for a long time, but since we are scheduled to talk about amenorrhea, let's go and talk about amenorrhea, and let's define it first.
Sure. So it's the absence of menstrual periods, right? A means not, so no menstruation. And there are really 2 types of amenorrhea. One is primary amenorrhea. This is when a young woman doesn't get her period until after the age of 15, which actually was me. Even though I'm almost 6 feet tall, I was really athletic when I was young. And so I didn't get my period until after I was 15. And then secondary amenorrhea is when a woman has a menstrual cycle and then loses her period for a variety of reasons.
Okay, so some of the reasons are, I think about hormone imbalance. I think of lack of progesterone many times, especially if it's completely absent, but if it's or irregular, can be lack of progesterone. Some of the things is stress, especially physical stress with athletes is very common. Female Olympic athletes don't typically cycle. Is that correct?
Yeah, that's correct. It's called the female athlete triad. And it's the presence of amenorrhea due to heavy exercising and not eating enough. So those 3 things kind of tend to go hand in hand for women who have too low of body fat to actually have their period. When you think about it, the body, especially a woman's body, I talk about this all day long with my clients, like it's so beautifully made and it's so, responsive to like cycles and stress. Like we are meant, whether, you believe it or not, our bodies are the only bodies that can carry babies. And so, we're constantly having to nurture this environment that could possibly allow us to carry a child, to a healthy full-term pregnancy. And so a woman's body is really, really sensitive to any change in environment or diet or stress, because the body knows that if things aren't working well hormonally, that it's not a safe environment for mother or child, to have a pregnancy at that time. And so, the loss of a period can be a really good indicator that something is going wrong from the hormonal perspective for a woman.
Yeah, absolutely. And in traditional medicine, what do we usually do for amenorrhea?
Well, we'll give the pill, but as Laura Briden says, a pill bleed is not a period. So you're not actually getting a period. You are getting a pill bleed.
Yeah. And so what from a functional diagnostic nutrition standpoint, what do you help women with?
So this is generally the cycle. I will tell my women, it takes 100 days for an ovarian follicle to reach maturity. Therefore, we have about a 3-month window that we're working with getting hormones back online, right? We have 3 full cycles, theoretical full cycles. We also know that, also as Dr. Laura Briden says, your period is your body's monthly report card. And so if you're not having a period, basically you're failing hormone class, right? But it's really, really responsive. The period and and the body's, hormone system for a woman in her 20s, 30s, and 40s tends to be quite responsive very quickly when correct interventions are made. So I myself, since I this is what I specialize in, like this is what I work with women in, every single day, restoring correct, menstrual function, working with women in perimenopause. I've seen periods come back within as little as 2 weeks, 1 month, 2 months, maybe 3 months for those harder cases. But just as we're very responsive and, again, respond by losing our period during times of stress, we respond by, kicking that period back into normalcy when the body is functioning correctly, when it's given the right things.
Yeah. I mean, this is, people that are listening and following you and us on our podcast, it's kind of like, we're repeating the same thing over and over again. I mean, our bodies are designed wonderfully to do things correctly. And women cycling when they're younger is a normal thing, and cycling regularly, that's what a normal thing is. But in order for that to be normal, you have to give it the right inputs. So like you say, the right food, the right amount of exercise. And yes, you can definitely exercise too much. The right amount of sleep. If any of those things are off, that cycle can be off. And I love what your analogy is, like a report card. That's a really good analogy. If you're not cycling regularly, you're failing. That's a sign of getting an F. So there are some things that you can do better, correct?
Absolutely correct. And I will just say again, I attribute that to Dr. Laura Briden. I did not come up with that myself, but I often find myself repeating it to my clients because it's such a clear analogy. Like they get it. A lot of my clients have kids. They've all been to school themselves. And so, most of us women also want to achieve high grades, from a metaphorical sense. And so once we put that analogy into play, they're working toward, boosting up their hormone grade by, yes, working on their diet, not over exercising, not under exercising, getting an appropriate amount of rest and sleep, and, working with the Dutch test to titrate appropriate supplements to really work on, getting them nourished again. And my goal with the supplements side of things isn't just to quote supplement, it's to rebalance and restructure that foundation so the body can kind of do what it's supposed to do. Like we've talked about this before, Shawn, our food system is so broken. We're not getting the nutrients and vitamins we need through food for many reasons. Even for women that eat a whole foods diet, our soil is just so depleted, they're not getting that magnesium and B6 and zinc that they should be getting. So looking at the Dutch and supplementing intelligently and appropriately helps get that cycle back online very quickly too.
Well, and sometimes the supplementation is going to vary. Actually, I should say most times the supplementation is going to vary at first while they're changing other things. So for instance, if you change somebody's diet and you add eggs to their diet and you add more meat to their diet, red meat to their diet, they might need certain things to supplement with at first, like creatine, for instance. But once they get regulated and, eating that regular diet, they might not need to supplement anymore.
And that's always my goal. Like I tell them again, supplements are just a supplement. They're a short-term intervention. My goal is to have you need 0 supplements. And on top of that, my goal is to have you not need me, you want to learn to do the things that are your birthright as a human, to understand your body, to eat appropriately, and to, not need these interventions that so many people are searching for, thinking that the answers are going to be in. The answers are in the very simplistic, holistic, foundational things that people can do no matter, how much you have to spend on healthcare, how much time you have, in your day. These things are very simple to restore hormonal and period health.
Absolutely. So as we wind this podcast up, Jennifer, tell us what you have a passion for.
Well, as you can tell, my passion is periods and perimenopause. Like these are my people. It's what I'm living myself. My whole friend group, we're all going through it. My clients are all going through it. So the more I learn, the more I, dive into the research, the more I see in my clinical practice, the more passionate I am about helping women through this really confusing time in life. It doesn't have to be confusing. It doesn't have to be overwhelming. And it certainly doesn't have to be painful. Again, as I just said, there's just such simple interventions that you could do. They're not easy. And that's the, kind of distinction. They're simple, but not easy. But man, restoring period and perimenopause health, it's one of the things that gets me out of bed in the morning.
Well, and because our pharmacy, Moses Professional Pharmacy, specializes in hormones, that's why we keep having you back.
And that's why I love being here. I just love getting to talk about these things with you and Janet.
So tell us a little bit about functional diagnostic nutrition.
So functionaldiagnosticnutrition.com is where you can find out more about what I do. I've been certified since 2016. I am obsessed with this method. It is just a brilliant way to help restore hormone and digestive balance. So if you want to, work with an FDN, you can absolutely reach out to us on this website. If you want to do what I do and get to run some of these cool tests and work with people yourself, then you can see there that top button says book a call or enroll now. The course is fantastic. It's self-paced. You learn so much. All these labs that I'm talking about, you're actually running on yourself. So you are your own first guinea pig in the course, and it's life-changing for so many of our students. It really is a cool process that Reed's developed.
Yeah, I love having you guys on. We've had Reed on, we've had Evan on, we've had a few of your practitioners on, and I really love what you guys are doing. And it's so, one of the things that I think is so powerful that, Jan and I are pharmacists, and, we don't largely believe in most drugs to treat long-term chronic disease. And because we really, really want to stress lifestyle type interventions, and that's what you guys do. And so thank you for doing that.
Thank you for doing the work you're doing. It comes from an on-high place here with two doctors, two pharmacists, spreading this word and message. It's really powerful. So we appreciate you right back.
It is. And somebody appreciated us. They just gave us a good thank you on here. GTS Share said that. So thank you for that comment. And as always, Jennifer, it's been a pleasure having you on. I think we do have you scheduled again next week. Is that correct?
It might be next week. I can't wait.
I don't know either. We'll be in contact when it's time. I appreciate your knowledge and wisdom, and one of the things I like is you keep things so simple and give great analogies, and I love that for myself especially, because it makes it easier for me to remember things. So, thank you for being on today. I really appreciate it.
Thank you, Shawn. Thanks to everybody who's hopping on with us today.
And thank you, listeners and viewers, for listening to Health Solutions with Shawn and Janet Needham. Tune in Monday to our regular scheduled podcast, 12:30 to 1:30 Pacific Standard Time. Thank you for listening.